the smoking cessation service now. Next slide, please. Okay, so the smoking cessation service is a service that's available to assist patients that are in hospital. They are advised by the cure team regarding their quit attempts, is worked back through them, and then obviously they're referred then and chosen pharmacy as their pathway to get support with their quit. So the SCS service is to help with to reduce the health inequalities and for higher rates of the stop smoking to be an objective of the service, to sort of help with the pharmacies and to help the GM hit their smoke-free, making smoking history within GM. So it's really important that we sort of try and get that service run successfully within the referrals. Next slide, please, Alison. Contractual responsibilities. Okay, so all pharmacists must have an approved CO monitor. It's part of the requirement to do that. So there's a list on CPE website where it tells you which ones you can actually purchase. You've obviously got the NRT provision, which is a maximum of 2 week supply. And also you've got NRT products, maximum of 2. They're at no cost to the patient, regardless of their prescription status. Check the drug tariffs for all the included products within that. And NCST, the Stop Smoking Practitioner Certificates for mental health, e-cigarettes, pregnancy, additional email, e-learning modules are available. Practices should be have completed the behavioural support and NRT provision. That's on the NCSCT standard treatment programme to be able to support all their patients through their consultations. The referral follow-up, the pharmacy must have at least 3 attempts should be made to contact the patient, the last of which must be on the 5th working day following receipt of the referral. So it's really important to do that, and we'll get onto that in a little bit further again in the next slide. And consultations, the initial appointment should be timed to ensure the patient doesn't run out of their NRT following discharge. Normally during discharge, they're normally given a week, maybe 10 days supply. So you really need to make sure that you are contacting that patient and getting that patient in for that first appointment within that time frame, so that we don't lose them within the service. For weekly or fortnight sessions, face-to-face or remote, for up to 12 weeks from the quit date. Next slide, please, Alison. This is a service overview. I'll just not to go through most of the things with that. It's just obviously that all GM trusts are actually live now with sending referrals. The Mental Health Trust and GMMH are also live in their Trafford sites, and the Pennine Care implementation is being planned looking forward. The Cure team are so passionate about this service and pharmacies providing it for them. I can't express how much they are, that they really are committed to their patients, and they really want the pharmacies are there. They're giving us the pharmacies an opportunity to help and support their patients, and they're really keen, like Alison said before, to be engaged with the pharmacies. It's really important that if you've got your local Cure team, that you're trying to contact them on a regular basis, because I think it's one of the Cure team, for example, really wanted to actually go out and visit all the pharmacies in her area because she felt it was really important to get that connection. So I think it's really, really good to sort of keep that in mind, and obviously just ensure that if the pharmacy is commissioned to deliver that service, that you do follow up with the patients, are followed up in line with the service specification and given that behavioural support. And if you can't provide the service, then decommission from the service, deregister from the service, I should say, because it's really important that the Cure team know who can provide the service and who wishes to provide the service. Next slide, please, Alison. Recording of information. So the farm outcomes templates are all available to all the pharmacies to help them deliver the service. They're all linked for the process. So you've got obviously the initial intervention template following the referral and receipt, and this is linked directly to the referral that you've received. And then obviously there's then the interim appointment template to record the weekly visits. There's a 4 and 12-week quick template to record the patient's outcomes, and then there's an onward referral mechanism for you to send to another pharmacy if you need to do that. And all the claims are actually automated through Farm Outcomes, so they're paid automatically through that. Next slide, please, Alison. Again, the referral process, the referral responses are much the same. So again, you can accept the referral, which will leave it in a pending state while you contact the patient to arrange initial appointment. This is when you're making your phone calls and not actually getting through to the patient as yet. So you keep it in a pending state there for you. The complete now is when you need to go back into that to actually complete that referral with the patient. This only completes, you can only complete the initial appointment module when the referral has been completed. When completing the consultation with the patient, you need to record this in a separate module, which is the module that's the initial appointment module. And then there's obviously the reject, unable to complete. And then you need to make sure that if you are doing this rejection, that you're giving a suitable rejection reason for that response. Next slide, please, Alison. Reasons for rejection. We don't offer the smoking cessation service, no longer offer the service. If you don't offer the service and you can't provide it, then you need to deregister from the service. And that will help the cure team to stop sending referrals to you. That's done by MYS. And then training not completed or no one trained to provide this service. So you can obviously do the e-learning courses if you want to do that. If somebody wants to continue to provide the service within their pharmacy, this needs to be completed, and the links are all there for you to actually do so. We're unable to do this service for a month. I think Alison has mentioned this before. If you can't do it for the month, then contact your cure team, contact them and let them know, and they'll stop sending you those services for that month or for that 2 weeks, etc. So if you've got work pressures at that time, obviously you can't do it continuously, but obviously we'd rather the cure team know to suspend for a short period of time to stop sending referrals through to you than lose you to the service. Didn't contact. All patients must be contacted. Ensure that your health champion is there to assist with the patients. I think Alison alluded to this before. It's the actual, it's the team effort. This shouldn't all fall down to the pharmacist to contact the patient. Your counter staff, any of the members of staff can actually be arranged to contact the patients, any of the patients for any of the services, and arrange for them to sort of contact the pharmacist at an appropriate time that's agreed. It's about communication within your team. No regular pharmacist to provide the service, no manager to complete. If the service cannot be provided as specified in the service specification, then it needs to be deregistered. And the last one was just one that we had was the patient. The pharmacist response was they didn't want to disturb the patient because he had been poorly and in hospital and was waiting for a medicine review. The patient had agreed to be contacted, therefore the pharmacist should have contacted them to help them with their quick journey.